Well, Lisa mentioned those rural hospitals across the country, many already struggling to stay afloat, that could face devastating consequences if those proposed Medicaid cuts in that domestic spending bill become law. To help us better understand what's at stake, I spoke earlier with the Director of Reimbursement for the Citizens Memorial Hospital System in southwestern Missouri, Tim Walters. Tim Walters, thanks so much for being with us.
Thank you.
So tell us about your hospital system, Citizens Memorial. How big of an area do you serve, and what's the makeup of your patient population?
So we serve about a 7-county area in southwestern Missouri, around 100,000 population. And roughly 55% of our patients are Medicare, 15% are Medicaid, and several more that are VA or uninsured. So about 77% of our patients are either government or uninsured. So that's a very heavy government payer mix. That's why we're very sensitive to any cuts to that Medicare or Medicaid funding.
So if the proposed Medicaid cuts go through, how serious would the impact be on your hospital system?
What's in the Senate Finance bill would probably cut about $3 million per year of funding for our hospital, which would be coming right off our bottom line when we tend to operate right at break even. So we would have to find a way to make up for those cuts. It's hard to cut expenses at this point, so curtailing services, trying to figure out a way to make up for those cuts would be very difficult for us.
Do you worry that rural hospitals like yours might have to shut your doors?
It's a possibility. I mean, we are hoping we'd be able to weather that kind of a cut, but we're not positive. We would certainly cut some services first before we would, hopefully get to the hospital itself, and we'd hopefully be able to withstand that. But a dozen Missouri hospitals have closed in the past decade, and I feel very, very confidently that there'll be several more that would close in the light of those kind of cuts.
And what's that mean for patient care?
Well, it'd just be further distances they'd be traveling. They'd be, right now we're about 40 minutes from the nearest urban area. And with our 7-county service area, we got patients traveling over an hour just to see us, much less to go on to urban areas. So further out in rural Missouri, if those hospitals close, it's going to be that much further to travel to access care.
Missouri Senator Eric Schmidt said recently, this is a quote, "The only people that would lose coverage under Medicaid are illegal immigrants and people who don't qualify or people who choose not to work." From your vantage point, how big of a problem is fraud in the Medicaid system?
We just don't see that in our patient mix. I mean, most of our patients are working, for example. I mean, I'm sure there are some that are not, but in most cases, because they have underlying health conditions or they're taking care of young children or they're elderly. And so we don't see that as a big issue in our area. So yeah, that's just not what we are experiencing.
As you mentioned, rural hospitals already operate on razor-thin margins. Is there any capacity, any cushion to absorb potential cuts?
That's the problem. We really don't have that much cushion. As I mentioned, with 77% of our patients being government, the only way we could raise rates is on that minor population of 23% of our patients that are commercial. And we don't even have, as a small rural hospital, we don't have the clout to negotiate better rates anyway from them. So the only way we can make up for it is to cut expenses, and which may mean cutting services. And that hurts all patients, not just Medicaid patients. So.
You've been speaking with lawmakers while you've been here in the D.C. area. What's the message that you're taking, and how is it being received?
The message is simply, Medicaid is a key part of what we need to operate on, and we just don't need further cuts in rural hospitals in particular. We live on a very thin margin, and so trying to support that care is something we vitally need Congress to do, is continue to support rural hospitals.
Tim Walters with the Citizens Memorial Hospital System in southwestern Missouri. Thanks so much for being here.
Thank you.